Hello, it's Janne. Dizziness is an extremely common reason why clients come to my office, and in this video I want to cover typical symptoms and common causes of dizziness. The topic for today is paroxysmal positional vertigo. Fun fact, a single person can have multiple causes of dizziness in one head. Typical reason for the dizziness can be expressed in four different categories. Muscle and tendon sensory system, as known as proprioceptive, visual sense and eye dysfunction, inner ear balance system, known as vestibular system, and other causes. If client is experiencing dizziness from the proprioceptive system, then client might describe shaking, swinging feeling, or they feel themselves a bit tipsy. There might be also muscle tension in the neck or facial area. If client is having issues with their vision and eyes, rapid eye movements might provocate symptoms. Clients focusing on multiple places becomes difficult and client might feel fatigue and dizzy after experience like that. Our ears are responsible for our balance system and tell our body orientation, how we are moving. From the duodenum sources, every fourth cause of dizziness comes from Bening Paroxysmal Positional Vertigo, or BPPV. The issue is so common, so in this video I want to cover a lot of information about this particular reason. Other probable reasons might need medical or psychological examinations. For example, neurological issues or problems with metabolism might cause dizziness also. Typical symptoms of BPPV will often happen in response to a change of posture. Typically, when your head has been in stagnant position for an extended period of time, a sudden movement can cause dizziness and sometimes cause nausea. Symptoms might be bad in the morning when you sit up from the bed. Typically, the symptoms will last for a few seconds to minutes. During a Prevelance study from 2007, symptoms like this happened to 2.4% of a large population. 60 to 90% of issues come from the posterior canal of inner ear, and most of the symptoms disappear in 90% of the cases within 3 months. I advise you to see the doctor if, along with your dizziness, you experience problems with talking, problems with hearing, clear visual interfaces, muscle malfunctions, problems with conscious, rapid changes in heart rate. In cases of BPPV, liquids are moving in the inner canal can disrupt the information conveyed to our brain about the position and orientation in the current space. This then leads to feeling of dizziness and nausea. If your client has a history of dizziness, then their upper neck might try to compensate the lack of information provided from the ears. This can lead to increased tension and proprioceptive issues. In the case of BPPV, the liquids in our inner ear canals needs to be equal in both ears, and if there is a thicker particle in liquids, then the circulation of the liquids starts to melt them down and symptoms should start to disappear. If you want to ease your upper neck issues, then here is a video recommendation for you. If you like to test your patient's inner ear, the best clinical test for BPV is Dix-Hallpike test. To do the test, have your patient sit on a long bench with their legs straight. Have a pillow behind them to create downwards 20 degrees angle of your patient's head once they lie down. Angle their head to look away at 45 degrees angle towards the ear you wish to test. Have the patient lie down quickly while maintaining their head position and keep their eyes open. Observe the patient's eye for the duration, latency, and the direction of the nystagmus. In a positive test, the patient will experience vertigo in this test, so allow them to have time before moving on to the next side. If the test doesn't yield normal patient experience or positive result after 3 tests, then move on to the supine head roll test. In this test, you want to have your pillow under your head, so your head is tilted 30 degrees angle to the front. Then do a rapid 90-degree turn with your head and remain the same position after movement. Do you get nystagmus or dizziness feeling? If nystagmus comes, typically it starts in 5 to 20 seconds after the movement and it might be present for 1 minute. If you get symptoms, wait until they pass. If you don't get symptoms, wait for a bit, then return to the middle line with the rapid movement. Perform the test with both sides. If you want to straight jump to the exercises, use the timestamps below. Here is a few fun facts I found in a few studies. Steenerson had studied 2009 with a sample size of 923 clients. Group 1 had 607 clients and they performed Epley's maneuver test. Group 2 had 233 clients and they all had limitation to their range of motion in their necks or cervical artery dysfunctions. Group 2 needed to have exercises appropriate to their physical capabilities. Group 3 was made from 83 clients and they did easier exercises. Clients had significant changes in their symptoms. The results were very much positive. If you have issues with the cervical movements or you need alternative exercises, you can always contact me. Then I will find suitable exercises for you. The bottom line is this. If you are not able to do the Epley's exercises, then try these exercises. Epley's exercise is extremely effective. During a Moreno study from 2014, 134 clients did Epley's exercises and the other were doing fake exercises. Epley's yielded significant improvements. For the Epley's exercise, I recommend doing 2 times a day until the symptoms calm down. Or if your symptoms are really severe, do the exercise for 3 to 4 minutes in a row and then rest. Repeat it a few times in a day. Once the symptoms begin to calm down, return doing the exercises twice a day until you have 7 symptom-free days in a row. If you like this video, thumb up would mean a lot to me and a lot for this channel. If you like to see more similar content in the future, subscribe. Have a great day and see you at the next one. And here comes the exercises.